This video will cover a standard chrome guided smile case from start to finish. We'll go into some details about the particular case and some techniques, but for the most part this is going to be a pretty straightforward case with a little bit of a twist on how the doctor treats the labial tissue on this case, on his technique, which is really interesting because one of the key features of chrome is that it's less invasive than plastic guides. It floats around the bone. It never contacts the bone. It is tooth delivered and it is pin supported. So there is very little labial flapping, and in this case very little lingual flapping and almost no labial flapping in this case because of the way the doctor did the surgery. So I thought we would share this case in particular. This is a smile simulation from our company, Preview, our partner company. They perform these wonderful befores and afters to either share with the patient or just to get us on the same page with the doctor. Make sure we're delivering exactly what the doctor is looking for. And we take this smile, this proposed smile, and we take the existing smile and we bring those into the software and we set teeth based on the soft tissue, based on the face, the eyes, the facial symmetry, shape, mold, everything based on the patient, not just the arch form. So the records, as I mentioned, are typical with chrome: full face, full smile, left, right, center retracted. We like to have this one retracted. I believe we did get one. And then a relaxed lip posturing as well. So those are the photographs. And the CT scan is patient always out of occlusion. I think some companies want it in occlusion. We want it out of occlusion because we do not use the CT for the bite. We use the models for the bite. It's much more accurate. So this is a regular CT scan, teeth apart, patient on the chin rest or patient biting on a bite stick. In this case, it was a digital acquisition. This is a case we're doing in Europe. So it sends it, cases come over much easier, of course, with digital acquisition. So this patient is severely closed, deep class 2, and really no centric contact. So fortunately, the patient had a partial, and so we used the partial to set the bite. And so there's 3 scans: upper, lower, in-centric bite, and then upper, lower with the bite with the partial appliance in place. All right, so photographs, CT scan, STL files, and please, on records, call us anytime there are any questions, anything that deviates from the norm, or if it's norm, call us because the records are just so important. And here is a retracted full occlusion, in occlusion photograph. Now, the important thing about photographs is that they are in occlusion. We use these photographs to confirm our articulation visually. So we look at the articulator, look at the pictures, make sure they're the same, so always in occlusion. And then, of course, we go to surgery. In this case, this is blue sky plan. Most of our cases are worked up in blue sky, and lots of layers of study models, scans, setups, that type of thing. And then we do the the implant planning, right? And then we go to surgery. This particular case is an Odin implant with a Odin surgical guide and a Nobel guided kit guide. So it's a dual guide system. We'll talk about that in a little bit. This office, you can see, ready for surgery. Up in the corner here is our SurgiMat. The SurgiMat is a unique tool that we make for chrome cases, and this essentially is taped on the wall, and it gives indication to the doctor of the surgery of what the guide should look like in the mouth. So in other words, just as an example here, this is a fixation base, and so when you're viewing the fixation base in the mouth, it should interact with the bone just like you see here on the image, so that it's not too close on one side and not close enough on another. You can see the implant and abutment trajectories. This is the dual osteotomy guide case, and then cross sections of the implants with the size, with the tool to use, with the sizing, everything. So it's a very, very handy tool at a glance when you're in surgery. The other component of the surgery mat is, so there's the surgery mat that goes on the wall. The other component of it is part that goes on the countertop, and this doctor used a little different technique, something more in the comfort zone, it looks like. But this is about 12 inches by probably 20, and it goes on the counter, and the doctor will place all the implants here, place the multi-unit abutments here, and then all the temporary cylinders. And you can see it's by implant site, it's by angle, and then of course the dual temp cylinders for the pickup of the prosthetic, and then a second pickup of the rapid appliance. This particular doctor had a technique which is very common to place the parts by a number in a number sequence. Of course, both work. We like to use the surgery mat simply because it does organize the parts all by the particular implant. But both work. So let's go through the surgery. This first part is going to be a typical chrome surgery. The pin guide delivers the fixation base. So the first thing the doctor does is seat the pin guide, and sometimes that causes a little discomfort, so you may anesthetize the patient first. That's usually the case. And then you seat it, and then you view on these windows to make sure the pin guide is seated. And as long as it is fully seated, then it's removed, and then it is attached to the fixation base using the chrome locks. If for some reason there's some rock to it, then it can be equilibrated like a denture. A little indicator, figure out where the holdup is and adjust it. If it's rocking a lot, then you want to stop, and we need to evaluate. That is really rare. These pin guides will fit. The casts have been vetted by you and by us. So the pin guide delivers a fixation base, and they are connected. And you'll hold the pin guide firmly to the teeth and the tissue. Do not let this move during the entire pinning procedure. It's critical that the fixation base is set in exactly as it was planned. So you hold it in place, and you will simply drill one at a time using our special fixation base with step-down drills. So you'll drill, place a pin, tap, tap. Now there's step-down because the apical 4 millimeters of the drill is a step down to 1.8 millimeters, where the rest of the drill is 2.0. And the pins were made in conjunction with them. So you'll tap the pins in with a surgical mallet, and you'll find that it's very secure on every case. They are transcortical, so you are tapping into the lingual cortex, and it will be tight. And this is a little bit of a twist on this case, where it's just not that common, and I think it's a good idea to leave the labial flap. The contraindication for this is that the patient will now have 4 holes in the labial tissue, and often those have a little suture, a suture in them, and it'll cause a little bit of discomfort. It's a little irritating for the patient. The healing will be a little slower because of it. But I'm sure the philosophy here is maintaining the blood supply to the bone by not doing a full reflection. The other contraindication could be there could be stitches that are right at the junction of the tissue and the prosthetic. But again, this is a nice technique to minimize the flapping, because unlike plastic guides, chrome has a very, very small footprint and requires much less flapping, much less aggressive flapping techniques, especially on the lingual, on the palatal side. So it's a nice technique. So once the fixation base is in, then the doctor will reduce the bone. I'm getting a little ahead of ourselves here. Reduce the bone. There was not a photograph of that completed, but the bone is reduced down to the level of the fixation base. So you're going to get a little tissue here in the way. You can probably just tuck that down in. In this case, there is a dual osteotomy guide process. The Nobel guided kit is used for drilling all the sites. And then the Odin guide is used for placing the implants. As you can see, there are notches here. Notch, notch. And this will correlate with the Odin kit for rotating the implants in the right index. Because there are angled implants. You can see, especially in the posterior, angled implants. So we have to get the indexing rotation of the implants perfect so that the temporary cylinders are straight up and down for the prosthetic. All right, so here we are. All the implants are in. Then the carrier guide goes on. Now on the anterior, these are straights. 1, 2, 3, 4 straight implants. And on the posterior, you can see the black marks and the notches for the angled implants. The trajectory, this is kind of like an all-on-4 trajectory of these distal implants. The trajectory follows this notch, follows the black line here. And so the abutment screw, the abutment, the implant are all in line with this notch. That is how you know your abutment is in the right rotation after you've indexed the implant. And a little fuzzy picture here, but you can see the MUAs are in, and then the temp cylinders go in. And you can see this really did a nice job with orienting the posterior implants. The temp cylinders are straight up and down, which makes picking up the prosthetic quite simple. These blue gaskets come with the case. They are used to block out the temp cylinders, to block out the MUAs. And then the prosthetic goes on, and then the blue plugs to block out the temp cylinder openings, and then you just simply backfill around the holes, inside the holes, to pick up the temporary cylinders. And then the prosthetic goes back in the laboratory, and it is cleaned up, intaglio and occlusal, just to make sure there's no holes or voids, and smooth everything out, and then take it to the mouth and equilibrate. You'll see in other videos there's a lot more detail on the conversion part of a case, but we'll just kind of go through this one pretty quickly. And then the prosthetic is seated. Some nice photographs are taken. So this was a very nice case. Fortunately, in this case there isn't a lot of posterior occlusion for equilibration. I know the seating part was very, very quick and a very nice result. So thank you for watching the Chrome Standard video.